when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC trap.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear. There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The 2 Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof.
Oh, yeah.
He's got a big cut to his head.
5 million people rely on them
All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high stakes.
Clipped by the wing mirror, look. Wing mirror and bonnet. She's got some nasty injuries to her chest and things. She's not breathing particularly well.
Once she's out, her body temperature will drop dramatically, so we need to work really quickly.
Not a lot of the left there at all.
Right, OK. Can you do that left-sided thoracostomy now, please?
High risks.
They've got reports of a patient that's in cardiac arrest. Their heart's not beating, so what we need to do is manually take over that.
So she's basically been in Morrison shopping and she's collapsed. We've shocked her.
And high drama.
There's a lady who's come off a horse, and apparently you could hear the patient screaming in pain in the background.
It's a cold winter evening at the Nostell Air Base,
One for you guys, this, I think.
and dispatcher Gav is scrambling the team to a serious road accident.
Knock down. York.
Pilot Lee will be flying his medical team 25 miles to the scene with the help of military-spec night vision goggles.
Andrews. Adjusted and working.
Yeah, adjusting working, I've done that.
Well, touch and breathe.
Okay, mate, on 2 is engaged, lifting out of here, outbound towards York. Okay, fairly light. Oh, look at the moon, how cool is that?
Nice.
Paramedics Kit and Matt are on duty with Dr. Becky.
We're heading to the east side of York to pedestrian hit by a car on one of the big busy A roads.
Now let's let us go. Send you some more
Details down on D4H if you got them. A 75-year-old female hit by a car at 40.
The accidents happened 30 miles from the nearest trauma centre. The helicopter's speed is critical in getting the patient treated quickly.
To fly, we're talking about from lifting 15 minutes, no more.
Lee's approaching the scene, close to a busy intersection on the York bypass.
Oh, so this one here, what is that? Is that a car park of some kind, this one here?
They're looking for a place to land.
This RRV at our 3 o'clock low, it's marking an empty car park.
Okay, right.
Lee's descending into an area of concrete surrounded by trees, hedges and lampposts. It's a risky procedure, even with night vision goggles.
Plenty of power. Speed's good, height is good. Trees on the right. No factor, continuing.
He's easing Helimed 99 down.
Tail's clear left, please, buddy. Nose is coming right.
Clear left.
Happy there, mate?
Yep.
Becky and the team are heading out to take over care of the patient from a land crew.
Clipped by the wing mirror, look. Look at the car. Wing mirror and bonnet.
The crash has closed a main road from York to the coast.
Hiya, I'm Becky, this is Kit.
How are we doing?
Yeah, better than this lady by the looks of things.
Yeah, Sylvia has been hit by a car going at 40 miles an hour. She was crossing the junction there. So, and she was hit on left-sided. Top to toe, she's cerebrally irritated. Left pupil larger than the other.
75-year-old Sylvia Dalton has a major head injury and appears to be losing blood internally. She was returning to her motorhome with her husband when it happened.
I'm Becky, I'm one of the doctors from the helicopter. Because of what's happened to her and the way she is, she's looked like she's got some nasty injuries to her chest and things. She's not breathing particularly well. We're going to pop her off to sleep and then we're going to take her in the helicopter to Leeds so that she goes to the right place as soon as we can, OK?
Dr. Becky and the team need to act quickly if Sylvia is to survive. They're going to put Sylvia into an induced coma.
There's no room in back of that ambulance, there's lots of people in. So what we're going to do is bring her outside, form an RSA out here, and then fly her to Leeds from here.
Her chest injury means Sylvia's not absorbing oxygen properly.
Sylvia, do you know where you are? You're not on an aeroplane, lovely. You're in an ambulance. I know you're hurting, darling. I'm sorry. We're going to make that better very shortly.
Sylvia, we've just got a little mask for you. Okay, it's just some oxygen. There we go. I'm sorry. I know.
Outside, Matt's preparing to anaesthetise Sylvia, a procedure medics call an RSI.
She's going to need a thoracostomy as soon as she's asleep. She's got a big flail on the left.
Got that left in there.
Yeah.
Pouch. There and there. Do you want some syringes out or have you enough?
I've got enough, thank you.
Blood leaking into Sylvia's chest is crushing one of her lungs. Once she's asleep, they will cut an incision in the side of her chest to relieve the pressure.
Let's get a blood pressure cuff on her. Let's get her out and get her off to sleep. I think that's where we need to go, really.
The temperature is plunging. It's already -1 Celsius. It's going to make their job much harder.
Once she's out, her body temperature will drop dramatically, so we need to work really quickly in this sleeping bag onto the aircraft and sort of do that really fast. We don't want her to lose body temperature, so yeah, it's not just about putting her to sleep, it's also about keeping her warm. We need to be slick at this, yeah.
Blood pressure last systolic was 120. She's just oxygenating really badly with SATs of 90.
Anaesthetising patients in the street is always a tricky procedure. But with little light, temperatures dropping and Sylvia's condition getting worse, the next few minutes will require total concentration.
So, potentially quite a dangerous procedure. So the plan is, we'll unsecure her. Are you happy to do mils?
As soon as she's asleep, they'll operate to ease her breathing.
Right, is that connected to high flow and turned on? Lovely. I'm going to swap the oxygen then and we'll pre-oxygenate with this as best.
Is she definitely getting a left thoracostomy, Becky?
She is definitely getting a left-sided thoracostomy.
In that case, it's all right. I'll get ready for that, Matt. It's on the other side there.
Kit, are you happy to do cricoid foot during the RSI, please? Lovely. Right, can you come and open her collar and identify your landmarks, please?
It's a complex procedure involving a precise combination of drugs.
She's dropped her blood pressure a wee bit, so we'll just pull back on the fentanyl a little bit. Matt, I can't really reach the cannula. Are you happy to do the drugs? Yep. So will you go for 150 of fentanyl, which is 3 mils? You're okay, lovely. Just going off to sleep now.
Well done. Okay. Well done, Sylvia.
She's now deeply unconscious. Time to intubate her and take over her breathing.
Let's go for it. She's not breathing.
Becky must slide a tube down her windpipe.
That's a minute since the last of the rock now.
Intubating her will allow her brain to rest and allow the team to get more oxygen into her lungs.
So I've got the grade 1 view. Tubes through the cords, bougie out please.
Bougie out.
Scope out.
A bag will now be used to manually fill her lungs with air.
Squeeze the bag please, Matt. Tubes misting. We've got CO2. Super, thank you.
Happy for cricoid off.
Happy for cricoid to come off.
And already she seems to be improving.
SATs are coming back up. CO2's 4.9, 4.5.
And then there's a problem.
Auscultate a chest for me, please, Kit. Yep. Because I've got SATs at persistently low 80s.
The level of oxygen in her blood is getting lower.
Quiet air entry.
The reason is unclear.
Good air entry. Not a lot on the left there at all, Becky.
Right, okay. Can you do that left-sided thoracostomy now, please?
Unless they can restore oxygen flow to her brain, Sylvia will die. This was already going to be a tricky procedure. Sylvia's survival now depends on the skills of Dr. Becky and the team. On the outskirts of York, Dr. Becky's hoping that removing blood building up inside pensioner Sylvia Dalton's chest will save her life after a road accident. Kit is using a scalpel to make an incision in the side of her chest.
Looks like it's in.
Lovely. Her tachycardia is immediately reduced.
Yeah, you can feel lung now.
Lovely. Good. Well done.
Okay.
Good work.
That's good.
Now the race is on to fly Sylvia to surgeons.
So we're going to take this lady over to Leeds, the trauma centre. She's obviously got some really significant injuries. The traffic's really bad. We're quite a long way away, so we're going to fly her in the helicopter. And instead of it taking upwards of an hour, it's probably going to take 10-15 minutes to get her there, which might be quite significant for her. She's obviously got some really quite serious injuries, so the trauma specialists at Leeds are probably the best people to look after her at the minute.
But Sylvia's condition is once again getting worse.
So sats have dropped a wee bit.
Got the finger in again?
Yeah, please.
Her chest was crushed by the impact. It looks like broken bone fragments have punctured blood vessels.
There's a broken rib just at the base of the hole. So.
There's lung.
There's lung? Excellent. That's good.
Yeah, you can also feel a pericardium, so let's not stick our fingers in it too often.
Pop the back arm back in. Let's go.
Yeah, thanks.
Might just have to accept the fact that their sats aren't brilliant.
They're going to make a dash for Leeds. They're transferring Sylvia into the helicopter. But now there's another problem.
I'm not happy. Sats are dropping. Something's changed. CO2's okay, but despite ventilating.
So start at her and have a quick listen.
Kit's listening to the sound of her breathing, in the hope it will give them a clue.
Lost all monitoring. Is there still oxygen in that cylinder? I think there is. I can see the dial.
Yes.
What are we doing? Why are the sats low? Why are they not? She's ventilating as best we can. We've got oxygen. She's got a significant chest injury. We know that.
She's got better air entry on that side after you've moved the tube.
Okay.
So do you think the tube migrated a bit?
I think the tube had migrated, yeah. So I've pulled the tube back a wee bit. Both sides of her chest are going up and down. We've got a good CO2 trace, so we did have a minute ago.
It's all back.
Okay, let's try and see if we can get our sats back up above 90 and then we can start moving again. Just be really careful with that fact that we don't bash this tube. Come on. Come on. Can anyone think of anything I'm not thinking of?
The team are running out of ideas. Then Kit comes up with a theory.
She's got a really weak radial on this side.
Just wonder.
So your BP. Do you want to start some
I
blood?
wonder if we give us... that's exactly my thought. Should we give her some blood?
They're going to give her an emergency transfusion to raise her blood pressure.
I know it's not ideal, but ultimately she's not going to do well if she stays here, is she?
Kit's alerting Pilot Lee. Only speed can save Sylvia.
Patient's deteriorated. We've just started blood, so we've been delayed on scene. Making our way around now.
Emergency ONEG allocated to us. Date tested 29th of December.
Good up.
Donor blood is being pumped into their patient. And it looks like it's working.
Okay, I think improving her blood pressure is improving her sats, because a millimetraminal and her sats are coming back up.
So it's all blood related?
I think this is all hypoperfusion. I think this is volume related, so I think blood is exactly the right thing to be doing.
That's running nicely.
Lovely.
Now that Sylvia's condition is more stable, the team need to quickly get her to the specialist teams in Leeds. She is still bleeding internally.
So this lady's blood pressure dropped quite significantly, and we think it's related to severe bleeding, potentially from her pelvis or inside the tummy, but also possibly the chest. It's difficult to know at the minute. We've given her some blood, which has started to bring her blood pressure back up a little bit, and she's started to improve slightly, but she's still very, very ill.
Slowly then, slide. Yep, got it. Okay, sliding slowly.
And up we go. Power's coming in. Love this aircraft, look at that. Climbing away, 6 on board.
Edison 99, we've lifted from scene. Routine 2.
Yorkshire.
In the darkened cabin, Becky is monitoring Sylvia's condition.
This lady's got significant injuries in chest and probably her pelvis, and has probably lost quite a significant amount of blood, which is why her blood pressure's low and her heart rate's high, and we're struggling to measure some of her observations. So we're giving her a blood transfusion to try and restore some of that circulating volume to try and keep her in a stable state to get her to hospital. We're taking her to the major trauma centre to give her best chance of survival.
But her blood pressure is falling again.
85 systolic at the minute.
They're on final approach to Leeds General Infirmary, but the team won't be able to relax until their patient has reached resus. This will be a long night for Sylvia's family, and the surgeons trying to save her.
Ready, yeah? Moving on.
It's just after dawn, and at the team's North Yorkshire Air Base, another shift is beginning.
Bit of oomph.
At RAF Topcliffe, paramedic James is at the controls for one of the trickiest manoeuvres of the day.
Tail square out.
Getting Helimed 99 out of the hangar.
So every morning it's important that we do the same checks on the aircraft. We need to make sure that both the helicopter and the equipment on there is ready. One of us checks the aircraft, make sure that the fuel's okay, checks the bulk fuel whilst the pilot does their check A, and the second paramedic will make sure that all the equipment is ready to go.
Lives depend on all the equipment working perfectly. And it's not long before the team and their kit are needed in the Yorkshire Dales.
Okay, we'll lift up, turn left. We will be downwind as we turn, all of the windows dropped off slightly.
Headers from 99, we've lifted from Topcliffe route to Skipton.
Helimed 99 is racing to a market town in Craven, where a woman is fighting for her life in a supermarket.
We've got reports of a patient that's in cardiac arrest. It's a viable arrest as far as we're aware, so the air desks tasked us to go and support our crews on scene. If they happen to get a ROSC, so return of spontaneous circulation, then we've got a few more skills that we can help to stabilise the patient, and we can transfer them to a different hospital rather than just the nearest ED if that's appropriate.
Even at 160 miles an hour, it's a 15-minute flight. The woman's survival depends on other members of the public delivering CPR.
Their heart's not beating, so what we need to do is manually take over that. So by doing chest compressions, you're effectively manually beating the heart. Maintaining blood flow around the body and ultimately oxygenation to the brain is what's important at this point. So if we can get the defib there, the emphasis is on that early shock, but the basics are CPR, and CPR is the one that's going to maintain the patient until the defib can get there.
And there's some good news from paramedics at the scene.
Patient now making respiratory effort, IJO removed, no 12 lead.
Pilot Harry's landing his medics just in time.
We've just landed at a rendezvous point that's been identified. The crew are bringing the patient round. They've had a witness cardiac arrest outside. They've had 3 shocks. They've now regained the cardiac output. Heart's beating again. It sounds as though they've done an ECG and there are some changes on there that are pointing towards a cardiac cause. So we're just waiting for the crew to arrive with the patient. We can assess further and see if we're able to take them to one of the regional cardiac centres.
The air ambulance can still make a crucial difference in this case. The faster she arrives in a cardiac unit, the more heart muscle can be saved.
1961, so she's basically been in Morrison shopping and she's collapsed. 2 doctors on scene, luckily, with the AED. They've started CPR and she's had 2 shocks from the AED. We've arrived, she was in VF, we've shocked her and she's come straight around. Quite agitated post-ROSC, so she's had 1 milligram of Midazolam.
Caroline Scott has already beaten the odds. Stats suggest fewer than 1 in 5 people survive a cardiac arrest.
So the interventions that they've done have been excellent, and this patient's now breathing for themselves. So the patient's still quite delicate, needs to be handled carefully. They've already had 1 cardiac arrest. There's nothing to say that they won't go into cardiac arrest again for whatever reason caused that at the beginning.
Sinus tachy, 120.
Catherine?
Yeah.
Hello, darling. My name's James. I'm from the helicopter, the air ambulance. All right?
Yeah.
Okay. Have you got any pain anywhere now?
Yeah.
Have you had anything more formal verbalised that?
No, that's the most she's been all the time. She's about GCS 10 in Bruce, and then she's just dropped down, dropped off when we got up to here.
Any cardiac arrest can leave victims with permanent brain damage caused by lack of oxygen.
Open your eyes for me. So 3. Can you talk to me?
Yeah.
Yeah. Do you know what day it is?
Yeah.
So eyes 3, verbal 3. 6 or 9, 12 maybe, 11.
The team are hoping that in Caroline's case, the effects will be temporary. They're measuring her level of consciousness on the Glasgow coma scale.
336-ish.
It's nearly time to fly. In this case, time is of the essence.
Ready, steady, left. The benefit of speed to get into a specialist centre is paramount. If the patient does happen to rearrest, it can be a little bit busy in the back. Obviously, we've not got as much room as what we would have in a normal ambulance, but it's that kind of balance between speed of transfer and space to intervene. That said, we've got various bits of kit on board that can make it easier for us. So we've got an auto pulse, which is a mechanical chest compression device, or failing that, we can resort back to basics as you would do in the street. So we can do manual chest compressions and ventilate via a bag valve mask.
The race is on to get their patient to cardiac specialist 30 miles away in Leeds, but her life is still on the line. On a sports field in Skipton, paramedic James is preparing to take off for Leeds with a seriously ill patient on board.
Right, I've got morphine and Medaz. Yeah. I'm going to give her 1 and 1 in a minute.
Caroline Scott has been resuscitated after a cardiac arrest, but her condition is still critical.
Yeah. Do you want some Tide one?
James will be monitoring Caroline's heart function throughout her flight.
If you want to spark up for a minute, mate, Arcel, we'll be on harness before we lift.
No, we're just preparing to lift.
Pilot Harry is flying their patient to Leeds General Infirmary, where surgeons will try to remove the clots that caused her heart attack.
We'll lift and go straight to a helipad from here.
Just to confirm, I'm on harness.
You are on harness, Roger. Happy lifted.
Once I can, if I can come off harness, Harry, for a sec. Once you give me the nod.
I'm just going to get some airspeed on stuff to drive me away.
It's a 15-minute flight. Caroline's condition seems to be stable, for now.
Everything's kind of fallen into play for this lady. The store, Morrison's, had a community access defib or a defib on site. Fortunately for her, there were 2 passing off-duty doctors that recognised this lady gone into cardiac arrest, and they've used the defib prior to the arrival of 999. They gave her 2 shocks, the crew then gave her a further shock, and she's got ROSC. She's sustained that spontaneous circulation since that time. She's been a little bit fighty, so we've given her some medication to try and control that to make her more manageable for transit. And her numbers are all looking fairly good for somebody that's had a cardiac arrest. So we're going to go into LGI, which is a specialist cardiac centre around here, where she'll be assessed with a view to going for primary angioplasty, which is the A1 treatment really for somebody that needs cardiac investigations. How far are we off?
2 minutes.
Right, I'm just going to give it another little bit of morphine and Medaz, because then I'll get back on my harness.
Roger.
And I don't want to fight him before we get there.
How much has she had?
1 and 1 from me, this will be 2 and 2 from me.
Yeah. Element 99 Alpha is visual in landing sign laying down.
Element 99 Alpha, thank you. Wind at Leeds Bradford remains 250 degrees, 12 knots.
Copy, thanks. Okay, leave us down and close on strap again, James.
Thank you.
99 landed LGI.
Caroline? Caroline? Hello, it's James again, one of the paramedics. You're in Leeds, darling, all right? We're going to look after you.
The team at the LGI will be able to run further tests and determine whether Caroline needs emergency surgery.
OK, this lady's Caroline Scott.
But first, she'll be stabilised in resus.
Witness collapsed in the supermarket. 2 off-duty doctors on scene, shocked with an AED twice, a 3rd shock on arrival of the crew, VF into ROSC. ROSC was around about 13-20 and she's sustained that since.
Doctors need to build up a picture of what happened. Caroline is still agitated.
She was in the supermarket, mobile, so she's, yeah. I say I've literally just picked her up from a cricket pitch.
Caroline's heart could still go into another arrest at any moment. Until the clot is removed, her life is still in the balance. In another department at the same hospital, doctors have now discharged another of the team's patients after an almost miraculous recovery from very serious injuries.
I've got SATs at persistently low 80s. Can you do that left-sided thoracostomy now, please?
Sylvia Dalton came close to death twice after a road accident in York.
And I can't remember nothing. I was out completely for about 5 weeks. I woke up and told me I'd been hit really bad with a car. And then they told me I was lifted up with Air Ambulance.
Something's not right, SATs are dropping.
Dr. Becky and the team fought desperately to keep Sylvia alive, as oxygen levels in her blood plunged due to massive injuries to her chest and head.
Well, I know there was a bleed on the brain. I broke my ribs and my pelvis. The doctor came to me and he said, he told me my injuries himself, and then he said, you'll be in this hospital for quite a few weeks.
Sylvia also had 2 broken vertebrae in her spine. She spent time in 3 hospitals, but is now home.
Well, at the moment, I'm feeling a lot better than what I have done over the last few weeks. I do my physio. I do it 3 times a day, and it's very, very good, the physio. I love doing it. I've still got a bit of pain, but it comes and goes, and just got to put up with it.
And she's very grateful to her rescuers that night.
What they did for me was absolutely marvellous. I can't thank them enough. So they've really brought me from nearly being dead to living now, and I'm having a good life.
With Christmas holidays being a busy time of year, it's business as usual at Air Ambulance headquarters.
1 male station.
In between call-outs, it's important that the team keep hygiene standards high. And today, it's Tony's turn in the sluice room.
It's not all glamour whatsoever. We spend a lot of time cleaning up. We generally work in quite messy, mucky environments, and you've got to keep on top of that. So a big proportion of our job is cleaning, wiping, and keeping everything in the clean and tip-top condition.
It's bleach for the floors, and a special washing machine that sterilises flying suits with ozone.
We land in fields, and at this time of year quite often it's a muddy farmer's field, so quite often we're caked in mud. A lot of incidents we go to, such as road traffic collisions, we're crawling around trying to get in and out of sort of vehicles that have been turned upside down. So we might have things like oil or grease on his uniforms. Sometimes it could be bodily fluid such as blood or vomit, so not very nice. You don't want it on your uniform, obviously for infection control as much as anything else. So it's just nice to be able to strip your uniform off and get it in the wash straight away.
And there's another job in the mud coming in.
Shall I go to this person who's fallen off a horse?
Where is it?
Tony, Dr. Andy and paramedic Sam are heading for a paddock in South Yorkshire, where a local ground crew need help.
1608, it's Sam on the ALS. Just let you know I'm sending HeliMed 98 to this job. It'll be about 10 minutes. When you get on scene, can you just ask them to move the horses away from the patient or any landing site?
HeliMed 98 Alpha is 145, miles on board into incident just near the M118 interchange at Thurcroft, requesting a basic service, please.
We don't have a huge amount. We know that there's a lady who's come off a horse somewhere near Rotherham. We've had a bit of an update that she's had previous spinal fractures. The dispatchers have listening, and apparently you could hear the patient screaming in pain in the background, so it does appear that she's in a lot of pain. So potentially got a serious injury from that.
Pilot Lee needs to ensure he doesn't cause another accident, with the noise of HeliMed 98's 2 jet engines.
Okay, first concern I got, mate, is the horse. Make sure that the horse isn't about. Yup. Okay, so we're well inside the wires, no factor. Got the domestics in the short bone of the field. Again, that's not really going to bother me. I'll probably go over the ambulance and land on that track. Which is plus of the ambulance, if you're happy.
The team are bringing their strongest painkillers to rider Joe Guest.
Something scared her.
Right.
She booked and I just couldn't stay on.
Okay. But you've remembered actually falling off then?
She said she remembered hitting the floor,
hitting the floor.
Okay. She said there were no LOC, but she felt instant pain to her middle, lower back, right leg and tingling in the right leg. She's got a previous spinal injury from a previous horse fall as well.
Friends rushed to help her.
She just went out for a hike with a few other folk, a few other children and a few people, and horses got excited and booked, and she's just lost her balance and come off.
The team fear Jo may have injured her spinal cord again. If so, it could be a life-changing injury.
Nice deep breaths in and out. So you got no pain in your chest at all? No. And you've actually landed on your back where you are now? Yeah. Okay, but you say you've got some pain in your hip? Yeah. Okay.
Andy needs to pin down the injury. It's crucial for her treatment.
I just want to find exactly where it hurts. So tell me when I get to a painful bit, okay? That's all okay? That's
there.
Painful there.
Here.
What about a little bit lower down in there?
There.
Okay.
There.
Which hurts more, up here or lower down in there?
Lower
down in there.
You didn't hurt at the top at all.
It doesn't, okay.
Each symptom is giving Andy more clues.
There.
They're going to slide her onto a rigid stretcher to protect her back from further damage.
So she might well have broken something. Pelvic fractures are really painful. There's lots of nerve endings around there. And the same with the femur. There's an awful lot of nerve endings around the top part of the femur. So if she has broken something, it's going to be really painful. But we'll carry really strong painkillers now, so we can hopefully get her comfortable for the short flight over to Sheffield.
But the pain is overwhelming.
Have some gas and air. That's going to help you, because we need to move you down this board a bit.
Joe, I just want to assess your hips and try and figure out what's going on.
Nice deep breaths. Keep dead nice and still for it.
Ah, there.
There, that's
Yeah,
it.
there.
So just let this leg come out.
Oh, God.
Straight.
Joe, we know you're in pain. What we really need you to do is not move about as much.
I'm
All
sorry.
right. It's okay, just try and relax. All right, so you keep nice and still for us.
They're going to fly her to Sheffield for tests.
Just get ahead to sort of midway on the stretcher. That's grand.
She's hemodynamically okay, so her pulse and blood pressure are okay, so it doesn't look as though she's bleeding significantly anywhere. And the pain's now well under control, just with a very small amount of morphine. So we've loaded her on. Because of where we are, we're going to fly her to Sheffield Northern General, which is the regional major trauma centre, so they can have a look at her and assess her further with x-rays and scans.
Clear left and right. Yeah, fantastic. Right then, I'll go out this way, I think. Charge.
Their patient's medical history means her case could be complicated.
6 minutes to run.
LS98, we've lifted scene en route to the Northern.
Lee's trying to give Joe a smooth ride, but it's a blustery day.
300, we're pretty much on the nose thereabouts, so like I say, we'll look at 300. We've got a couple of wind indicators out there. Still good left. Yeah, thanks mate. A little bit choppy, but still well under control. Power's good, height is good. There we go.
Is that pain a bit better? That's good. Okay. So we're at Sheffield now, so what's going to happen is we're just going to take you off the back of the helicopter, put you onto the trolley, push you down the ramp into A&E, okay? Once we're there, we'll hand over to the team in the resus room, and they'll have a good look at you, go over everything in detail with you, get you sorted. All right.
If there is damage to her spinal cord, this injury could affect her for the rest of her life. Winter has Yorkshire's moors and dales in its icy grip. There's snow on the ground, and the temperature is -3 Celsius.
Job, man. It's over towards Richmond, mate. It's quite a mile into a field with an angulated leg.
Paramedics Pete and Matt are being scrambled from their base at RAF Topcliffe, where the snow is yet to lie, to an accident in Swaledale. Colin's today's pilot.
Right, what's the job? 59-year-old fallen.
It's not horse-related trauma, is it?
No, it sounds like a walker. We're just heading up North Yorkshire. I've got reports of someone that's fallen, but they're believed to be about half a mile into a field on a hillside. And it's not surprising today, for people to have slips and trips if they're about. It's been very wet from a couple of recent storms, and this patient's reported as having a severely angulated foot/ankle, which could be limb-threatening in the extreme.
But first the team must find their patient on an isolated hillside.
The report of this casualty is that they're wearing a red coat. Oh no, sorry, the caller has a red coat on, the patient has a blue coat on.
Does he have a white carnation in his left lapel?
How did you know that? Have you been here before? I cleaned the floor in here earlier.
Oh God.
Missed the grid then, Colin?
It says on the right here somewhere.
But there's no sign of the casualty. They're asking base for help.
Sorry, any ideas of the north or south of the river to begin with, please?
Yeah, mate, on the call, I think it's north of the river. I can actually hear you on the call. I'm going to get her to go into the middle of the field.
Thank you.
North of the river.
Down there. Got it? Yeah.
9-8 from air desk. You appear to be right over the patient now.
Yeah, we've got it. Red coat laid on the floor.
Could be access, isn't it?
Brilliant, thanks, Matt.
Okay, happy with that flat bit there. Riser to the right. If anything goes wrong, we'll go to the left into the low ground.
Yeah.
Colin spotted the only patch of flat ground within half a mile.
Okay, just got riser ground forward and right. That's in limits.
9-8's landed.
Pete is heading out to start work on their patient. He's been lying in the snow for 45 minutes.
Hello there. I'll come up here. My foot got stuck, fell back, and I felt it just twist, back on my head. I fell back on myself. Okay.
Gordon Pickles was out hill walking.
Is that the only area you think you've hurt? Okay. I'm going to have a look, see if we can just get a vein up, give you some pain relief before we start moving around.
Gordon and his wife Pat had booked into a local bed and breakfast for a short break.
How are you doing for temperature? You warming up or?
I'm just a bit shaky. Just keep his hand there. Probably matters is a bit shaky. You all right there? Just going to feel scratching back of your hand.
In these temperatures, a minor accident can soon turn into a life-threatening emergency, even for well-equipped walkers.
We were walking on a track along the top from Reef and got a bit lost, and so decided to walk down the fields to come out onto the road at the bottom. But it was really muddy and slippy, and Gordon slipped on a wooden post that was on the floor and got his foot stuck and then just went down.
We're going to start you off with some morphine, okay? Then we'll have a look at the leg, and from then on we'll decide if you need something a little bit straighter for us to put that into a splint, okay?
Mountain rescue volunteers have arrived to help.
Are you all right to work under the shelter? Because he's getting quite cold, yeah?
I would say just be careful, his foot's around there, that's great stuff. Have you had morphine before?
Not that I'm aware of.
Sometimes people feel a little bit itchy up their arm when this goes in.
Gordon's ankle is dislocated and probably broken as well. It's cut off the blood supply to his foot.
So we're looking sort of really distal tibial pain.
They're going to have to straighten his ankle to restore blood flow.
Not your best socks, are they?
Best winter socks, snowflakes on them and everything.
A mountain rescue doctor has arrived to help the team.
Hi. Hello there, you all right? Just going to get some ketamine. He's had 10 of morphine so far.
Right.
So the gentleman's ankle looks like it's quite badly dislocated. Maybe a fracture dislocation, but closed. So we've given some morphine as an initial pain reliever. But it looks like we're going to have to do some form of manipulation, which is going to be incredibly painful. So ketamine is going to be a stronger analgesia for this chap.
Gordon needs reassurance, and the team's strongest painkiller.
Right, this is the good juice. Now remember, it's very good at taking pain away, this. It's extremely good, and it works quite quickly. If you feel a bit funny, just let us know.
We're just going to get into position.
If it's too much, let us know.
The ketamine is helping. Thankfully, it also gives patients temporary amnesia.
Okay, just relax, breathe. Just breathe again now.
So were you out here on holiday?
Yeah.
Good. We had a nice bed and breakfast. And were you off to the pub later?
Hopefully.
Oh, good.
Matt's small talk has a medical purpose. He's trying to prevent frightening hallucinations caused by the drug.
No. That's fine.
It's done now.
Okay, just nice and steady.
They've managed to restore blood flow, but it's clear it's a bad break.
Good, and now we've moved it, and you've got your legs stretched down a little bit. How's it feeling pain-wise?
Can't feel anything.
That's brilliant.
Wonderful.
Just what we wanted.
He's now much more comfortable.
Right, guys, as far as packaging goes now, if you want to crack on with your bits.
So we've successfully given ketamine. We're giving him about 30 milligrams at the moment. It's alleviated his pain relatively well. We weren't able to manipulate his ankle as much as we'd have liked. However, we've got into a position that's that's comfortable for him. We've put a vacuum splint on so it's holding it nice and firm. And because we've given ketamine, and from the location that we're in, we're going to fly him 15 minutes to James Cook from here. So we're just trying to get him on the aircraft, which, as you can see, it's quite difficult because it's muddy, slippy, quite dangerous for us all to get him there. So we're just trying to take our time, really.
Gordon's ankle will probably require surgery. Pete's warning the regional trauma centre.
Yeah, I'm ringing from Helimed, wanting to bring in a patient, please. So we've got a 59-year-old male who has fallen on a hillside. We'll be with you in about half an hour.
Colin's going to fly their patient 30 miles to Middlesbrough.
I'm going to put these on. You won't be able to speak to us, but it'll just keep some of the noise out while we're flying, all right?
Over. I'll come back once I feel it's safe. We'll fly away. We'll go to the left. Okay, 15. Okay, in the back.
We're okay in the back.
That's from 98. We've lifted routing to James Cook.
Gordon and his wife are serious walkers, but the Dales can catch anyone out.
The guy's been really well prepared, clothing-wise, so he's wrapped up, he's got lots of layers on, he's got all the right type of equipment on. But even with those sort of clothing to that standard, if you fall over, if you're on the floor, if you're immobile and then you're getting a bit damp as well, then anyone is going to get cold. That can soon lead to hypothermia. Without our resources attending, the mountain rescue guys turning up as well, a simple injury could be life-threatening.
Gordon's heading for X-rays at the James Cook Trauma Unit.
98, we're finals for James Cook.
Roger, thanks.
He'll soon be in the hands of orthopaedic specialists.
Gordon, we're here now. How are you feeling? Bit spaced out.
He will have to wait for the X-ray results. This looks like a bad break, and it could be months before he's back in his walking boots. Gordon was found to have a complex fracture in his ankle, and he underwent surgery to have it pinned. He was in hospital for 6 days, but after several weeks in plaster, he got back on his feet, and he and his wife are now looking forward to hill walking again.
She's basically been in Morrison shopping and she's collapsed. She was in VF, we've shocked her.
Specialists found Caroline, who suffered a cardiac arrest in her local supermarket, was not suitable for surgery.
Hello darling, my name's James, I'm from the helicopter, the air ambulance, alright?
And she was prescribed drug therapy to thin her blood. She was sent home after 3 days in the LGI. Jo, the rider left in agony after her horse threw her, escaped with torn muscles and tendons in her back and right leg.
Keep your head nice and still for us, don't thrash about.
She was confined to bed for 3 weeks. She's since given her horse to her son.